Good morning, Peter Goertz. I'm a psychiatrist. Frustrated doctors and systemic problems in psychiatry. Would you like to see a psychiatrist who's already frustrated before you walk into the office? These things happen. Yesterday, I was sitting at my computer seeing a patient virtually, an emergency room patient, and I kept on getting pop-ups, messages from the nurse, the pharmacist, because a patient of mine on clozapine was not able to obtain his clozapine. It turns out the prescription had gone through 10 days before, but it seems like pharmacies are often overloaded with work, maybe short-staffed, and there was some issue. So I was essentially going back and forth from talking with the ER patient to answering messages for about maybe half an hour, maybe longer. So we do not practice in a vacuum. You can have all the book knowledge possible, know about psychopharmacology, psychotherapy, internal medicine, neurology, but you still may not be prepared for some of the frustrations or potential frustrations that occur. So how do you like it when you're trying to get to another city and your flight is canceled? How do you deal with that? I was once locked in an elevator, stuck in an elevator for about 45 minutes, half an hour, 45 minutes. What had happened was I was 19, I was in a discotheque on the 7th floor, and it was time for them to close, maybe 2 a.m., and everyone just pushed into that elevator. And it was only intended for 7 people, but there were, I think, 11 maybe, quite a few people more in that elevator. And it was one of those elevators that had a swing out door so you could open the door. It was, part of the door was glass, but the elevator was so heavy on the ground floor that it was a little bit too low because of all the weight with 11 people instead of 7 people. And the door would not open. And the reason I'm mentioning that is there were 11 people in the elevator, but very different reactions, everyone in exactly the same situation. But the levels of frustration, anger, etc. were very different from person to person. So the key is not the objective outer experience necessarily, but our internal subjective experience is very connected with the issue of whether or not we get frustrated. So we want to try and be creative with potential frustration and potentially frustrating issues. I recently missed my flight connection in an airport. I was actually on time. I was there before the plane was supposed to leave, but then the airline person told me, well, they leave about 5 minutes early from the gate. So sometimes, you can't win sometimes. So I did try and use that time at the airport. I was in the airport maybe 6 hours. I went to a prayer room. They had a prayer room in the airport, and I did some Qigong and Tai Chi. And you can use situations like that, for instance, to make a telephone call to someone you want to talk with. So it is possible to be creative. A while back, my computer at work was crashing very frequently, which can really be a problem because the system or our organization wants us to be productive, but it's hard to be productive and see a lot of patients if your computer's crashing very often. And at one point it crashed 4 days in a row. The system has its own issues. Nowadays, it can be very difficult, if not impossible, for patients to be hospitalized psychiatrically long-term, even if they need it. I recently saw a 14-year-old young man who had been hospitalized, I think maybe 5 times already this year, psychiatrically. He could get very violent, and his family was afraid of him. but they kept on accepting him back from the hospital. At least this most recent time, they were afraid of him, but accepted him back. And it had not been possible for the staff on the psychiatric ward, apparently, to find a good residential setting for him. People sometimes drive with significant cognitive deficits, let's say in their late 80s. They may be driving when, due to the cognitive deficits, they probably should not be driving. Another systemic issue is related to insurance. So a while back, a patient of mine was on Seroquel, and his insurance at some point no longer covered it, apparently. So we ended up switching to Haldol, and he was taking way more, it turns out. He was taking way more Haldol than prescribed. And he ended up in the ICU of a hospital at one point, and possibly from taking too much of the Haldol. Now, often when people are hospitalized where I practice, they end up having to go to different cities because there aren't that many psychiatric hospitals, and they may have to be transferred to a psychiatric hospital from the emergency room and end up going to a psychiatric hospital in a different city, maybe even hundreds of miles away. So that's a systemic problem in that the family would have a hard time visiting, and the patient is just a long way from home then, being hospitalized in a different city potentially. People who are violent, psychiatric patients who are violent or autistic or both, are often not accepted by psychiatric hospitals for psychiatric hospitalization. They end up staying in emergency rooms for days on end, and we try and treat them psychiatrically as best we can while they're in the emergency room, but that's really not a good setting for patients to be in for days on end. And of course, financially, it's very expensive for that to happen. People with COVID, psychiatric patients, are not accepted often by psychiatric wards, or generally not accepted by psychiatric wards. So you have to treat them also maybe for days in an emergency room. Another systemic issue is documentation. Recently, in my opinion, in our system where I practice, that issue has been less of an issue than in the past. But still, documentation potentially can be tedious and, in that sense, interfere with care because you're spending so much time with documentation. So, in my opinion, you want to see potential frustration due to, for example, systemic issues in psychiatry. You want to see potential frustration as an opportunity to be creative. And one example is not work-related, but way back in my 20s, I was asked to leave an apartment, basically was kicked out of an apartment, and I was very fortunate. I was able to get a much better apartment. I had been living with roommates. I was able to get a much better apartment for myself, alone, a one-bedroom apartment, within a week or so. So you never know. Things that look bad or frustrating can often flip into the opposite and be an advantage, especially if we're creative. Thank you.